Good evening. Today we'll be discussing golden nanoparticles for drug delivery and cancer therapy. Okay, so despite the commonly used nanomaterials such as liposomes or carbon nanotubes, gold nanoparticles or AUNPs are popularly studied in relation to cancer treatment. So to clarify, the nanoparticles used in the experiment were gold nanoparticles, and they are 1 to 100 nanometers in diameter and may be defined as inorganic gold particles that become colloidal gold once dispersed in water. Their use in cancer therapy is significant due to their functional groups designated around the particle itself. So in the image on the right, you can see a visual representation of a gold nanoparticle and the characteristics surrounding the particle surface. Some of the characteristics include functions such as polyethyl glycol or PEGs, which help improve gold nanoparticle distribution, small interfering RNA that protect RNAs from nucleus degradation, and of course, the fluorescent dye that makes them detectable. And all these pieces, along with peptides and antibodies, make up AUNPs, which act as a vehicle for imaging agents and drug delivery in relation to cancer therapy.
I am going to be talking about the application of the nanoparticles. A tremendous technological interest has been given to gold nanoparticles because of the numerous unique properties they possess. These include, but are not limited to, their ease of synthesis, their electronic properties, their chemical stability, and the unique optical properties they possess. Now, even though gold nanoparticles are not being widely used for clinical applications, the researches on gold nanoparticle-based drug delivery, gene therapy, photothermal therapy, and radiotherapy all show promising results, and they have proven to be potentially viable solutions in the future. Now, in the picture provided above, we can see a physical representation of the numerous advantages and benefits gold-based nanoparticles can have for us in the future if we continue to research this nanoparticle. Now, in this article, the main advantage that is being focused upon is the constructive contribution that gold nanoparticles have on cancer treatment. That is the main focus of this article. It is certain that gold nanoparticles will continue to play a significant role in improving the biomedical field in places mentioned before, like drug delivery and cancer therapy.
The application of nanoparticles in medicine can be seen in this example through the use of gold in drug delivery and therapy for cancer treatment. Gold is an effective nanocarrier and is used to carry various drugs, such as peptides, acids, proteins, and chemotherapeutic agents. Gold nanoparticles are effective in transporting these drugs due to their following qualities. They are biocompatible, meaning they can attach easily to other biochemicals and transport them. They also have a large surface to volume ratio, meaning they can carry more of a drug. Their small size also allows for compactness, and the chemical properties of gold also make it more stable over higher temperatures. And finally, gold is highly reactive to living cells, meaning it's more effective in killing unwanted cells. These gold nanoparticles are also effective in therapy to kill unwanted cells. This is through a process called photothermal therapy, where a beam heats nanoparticles in order to have this nanoparticle eliminate tumors, in this case, the nanoparticle being gold. Adding on to the reasons mentioned before, gold nanoparticles are also advantageous for therapy because of their effective light to heat conversion and ability to absorb infrared light, which penetrates tissue more deeply than other wavelengths.
Hello, this is the current applications to technology and improvements portion of the presentation. So for gold nanoparticles, as previously mentioned in the presentation, they are known for their optical properties. And in this case, their interactions with light. And because of this, gold nanoparticles have shown a lot of uses in the field of medical imaging and diagnostics, primarily in the visualization and screening for cancer. So currently there have been a lot of studies done in on rats to see how gold nanoparticles can help doctors better identify cancerous growths and to better see them on X-ray imaging. And how this improves upon current cancer screening, because it's X-ray, it's X-ray imaging. However, there are a lot of limits to what current technologies in that it can't tell you exactly if something is cancer. It can only show signs of it, but a biopsy is needed to confirm whether or not. But gold nanoparticles have shown to have the passive ability to accumulate on top of tumor cells, and because of their color, they're also an ideal contrast agent for X-ray based computer tomography imaging. So this improves on it as it makes it easier to identify which growths are cancerous, and because they can easily attach themselves onto cancer cells, we know where cancer cells are. But there are also other treatment therapies for cancer diagnosis under development, and in the future you may see a lot more uses for tumor visualization as well as just bioimaging.